Hello, my name is Brian. A few years ago, I had a profound and humbling experience with the NHS. The experience of the quality of care and compassion my dad received when he was dying. I wanted that experience for everyone and their families. Everyone wants the best possible care delivered in the most cost-effective way, but this isn't an easy challenge. We have an increasing demand on our NHS services, an aging population with multiple long-term conditions, unhealthy lifestyle choices, rising expectations and inappropriate use of NHS services. We also have an increasing deficit of skilled staff, an aging workforce with many close to retirement. Recruitment and retention is becoming more difficult. Our current employment model isn't reflecting the changing expectations of the workforce, and many are leaving the NHS for the private sector. Filling this gap with agency staff is costing the NHS billions. I had a vision, with the well-being of healthcare workers at its core, to create a multi-specialty online community workforce, delivering better care closer to the patient's home. So over the last 3 years, we've been developing an approach that makes this possible. We've set up a public service mutual, so all those involved in delivering the care are co-owners. They have a voice to help shape development of the organisation, as well as a share in the profits. Healthcare professionals, carers and volunteers register for flexible working hours, and the NHS trusts have direct access to an experienced, qualified workforce to fill empty shifts with no expensive agency fees. For example, the ambulance service trusts have direct access to an agile workforce to cover shifts where vehicles are available, but the crew are not. Using the latest technology, members can choose when and where to work to meet their lifestyle needs, enabling a better work-life balance, enhancing their personal well-being, which we already know is clearly linked to good clinical outcomes. This will attract back part-timers, volunteers, retirees, parents, and those qualified but not currently employed by our NHS. Our members using the service get paid the same rate agencies pay or higher, and will get paid directly and promptly. NHS trusts pay a fee based on their usage of the platform. There's no margin added to the hourly rate, no abstractions, overtime and sickness, and no non-recoverable VAT. We've also partnered with the Open University's FutureLearn, an online education platform, so members of the multi-specialty community workforce can develop their own capabilities, skills and qualifications in their own time and at their own pace. We care passionately about our NHS, and we want to sustain and further develop the caring and compassionate culture that it has. Our simple, innovative idea disrupts the current employment model, and it's been designed with the well-being of those who care for our loved ones at its core. Come and get involved, become part of the journey, and help turn our vision into a reality.